Hi, I'm Dr. Messina. Today we're going to be discussing the Omicron variant, or B11529. At the end of this video, you're going to understand what the variant is, why it's such a major concern for the entire world, how it was identified, how it interacts with our natural immunity, immunity from vaccinations, and monoclonal antibody therapy. And we're going to also discuss the good points about it and the bad points about it, because there are both. The Omicron virus was first noted in Botswana on November 11th, 2021, and 2 days later in South Africa. The patients presented with 5 major symptoms: headache, fatigue, sore throat, sneezing, and coughing. When the cultures were sent out, the nasopharyngeal swabs was sent to the laboratory for identification, they found that it was indeed a SARS-CoV-2 virus. However, it lacked the genetics for a spike protein. That was quite interesting because that spike protein is an important feature of the SARS-CoV-2 virus for entry in our cells. And for it to not have the spike protein would have been highly unusual. Well, further investigation showed that the virus did have the spike protein, but it was so badly mutated that the laboratory equipment couldn't pick it up. So what made the CDC so concerned about this variant? Well, one, the rate of spread. The rate of spread, it seems to double every 2 days. Second, some of the gene mutations were from viruses that bind to the receptors stronger, caused a more profound disease, and caused an infection earlier than previous viruses. When they started investigating these mutations along the spike protein, it became very alarming because that spike protein is important for the virus to enter our cells. The spike protein is what our natural immunity is looking for. The spike protein is what our vaccinations are seeking, as well as our monoclonal therapy. So when it was found out that the protein had 30 mutations on it, it immediately led one to think, is it going to create an entirely new virus? We also have a perfect storm going on in that we now have Delta circulating, we now have Omicron circulating, and we have the flu circulating, and this year's flu vaccine did not target the most common circulating strain. So we have 3 viral illnesses that all look very similar to each other going at the same time. It was the CDC to classify Omicron as a variant of concern. It's done this before. Delta, when it arrived last spring, was very rapidly spreading as well and seemed to cause slightly more severe disease than the Alpha variant, made the CDC list Delta as a variant of concern as well. People have asked me, how did they get at the name Omicron? Well, it's simple. They've been following the Greek alphabet when it comes to naming variants with this SARS-CoV-2 virus. So we had A, alpha, B, beta, G, gamma, M was mu, and now we're on O, Omicron. People have also said, who is causing these mutations and who's doing this to us? Really nobody. Viruses tend to mutate in order to preserve themselves. You see, a virus doesn't want to kill its host. A virus wants to get into your cell, go to the ribosome, and instruct that ribosome to stop producing whatever protein they're supposed to produce and start producing them, the virus. And then they jump to the next host. So they change a bit in order to evade some of our systems that we have set up to protect us from the virus. So seeing gene mutations is common with viruses. These gene mutations sometimes render the virus more potent, and sometimes they render the virus less potent. A person who had COVID-19 in the past, where their immune system not recognize that spike protein anymore and allow them to be reinfected, which seems to be the case. South Africa is now discussing cases where people had a previous infection and now infected again. And we had that in Texas yesterday. There's also the concern for what does the spike protein mutations mean for our vaccination program. Now, whatever you might want to think, that vaccination program has been an excellent means of preventing severe disease, especially in susceptible individuals. And now, if we had a protein so mutated that our vaccines don't notice it, then we might have a problem. Turns out that the vaccines look for 3 gene sites on that protein, and all 3 gene sites have been mutated, which seemed really horrible for our vaccination program. Well, here's what happened. The Johnson & Johnson vaccine is now useless when it comes to neutralizing Omicron. The Pfizer and Moderna vaccines fared a little bit better. If you've gotten only 1 injection of either the Pfizer or the Moderna vaccine, you really have no immunity to Omicron. If you've gotten the second injection, that immunity jumps up from 0 to about 25%. Now, should you have just gotten your second injection, there's no need for panic, because over the next couple of weeks, you're going to develop a high level of antibodies, and those antibodies should offer a good modicum of protection until you're able to get your booster vaccine. Once you got the booster vaccine, Pfizer and Moderna jumped from 55% to about 80%, which is excellent. Very few vaccines go to 100%. In fact, the only one that ever did was for smallpox. Now, what did it do for the monoclonal antibody therapy? The monoclonal antibodies are a little-known treatment that can be offered to people with mild to moderate disease early in the course of the infection who have a high potential of developing severe illness. The monoclonal antibodies are antibodies designed to basically clump onto the spike protein and prevent the virus from getting into your cell, therefore it can't replicate and make you sicker. And there are 3 monoclonal antibodies out there. The first monoclonal antibody is bamlanivimab. It makes Omicron seem simple. The second monoclonal antibody is casirivimab. And the third monoclonal antibody is sotrovimab by GlaxoSmithKline. The first 2 were initiated mid-2020, and as time went on, became a cocktail with another monoclonal antibody to make it a little more effective. But I'm not going to get into that detail right now. Unfortunately, the mutations on the spike protein have rendered the first 2 monoclonal antibody therapies ineffective at neutralizing the Omicron variant, which is bad because those were the 2 most common monoclonal antibodies used. Fortunately, the third one, sotrovimab by Glaxo, does neutralize the Omicron variant. The unfortunate part is, because it wasn't one of the ones used quite frequently, it's in short supply, and the supply chain won't be increased probably to mid to late January. So we have one arm kind of tied behind our backs when it comes to therapeutics. So what are some of the bad points? And I'm going to save the good points for last. So some of the bad points are the mutations allow for a more rapid spread. They allow people to bring this home to the family at a rate 3 times greater than the Delta virus. It evaded our natural immunity to some degree. It also evaded our vaccines and the monoclonal antibodies. And those are some of the major negatives about this viral variant. Now, what are the positives? One of the good things about our immunity is, even though this Omicron has been so mutated that there's the potential to get reinfected, we do have another arm of our immune system that's offering some kind of protection. We have a humoral part, which is the antibodies, and then we have a cellular part, which is T cells, among other things. Well, the T cells have been involved, whether you've gotten a vaccine or whether you've gotten the viral illness, and they still will offer some level of protection. So it's really not all bad when it comes to these mutations evading our immune system. There are a lot of positives. First off, a study in Hong Kong found that some of the gene mutations were for viruses that preferred to stay in the bronchi and avoid the lung, which is great because when people have respiratory failure, it's respiratory failure secondary to the lung injury. They found that there's a 10-fold decrease in the risk of developing an pneumonia with Omicron. That's great. And it's a potential that it's a milder form of the disease and that the patients presented with those 5 complaints that I mentioned earlier. Right now in South America, they're stating that their patient load has been increased significantly. However, hospitalizations haven't increased significantly, which is good. However, the United Kingdom is saying the opposite. The United Kingdom is saying they're finding that it's no different than the Delta when it comes to severity. It's not worse than the Delta, but it wasn't better than the Delta. And you're going to see this type of conflicting data until more time goes by. You can't say because it did something in South Africa, it's going to do that in the United States, and the reverse as well. But right now, it looks like it might be a milder form, and that's good. So what can we do? Well, the one thing you can do to protect yourself, and it's not popular with everybody, would start to get your vaccines. Second thing would be to be aware of your surroundings and avoid large crowds, especially indoor, non-masked large crowds, and as cumbersome as it might seem, to wear your masks. And by doing these things, you could possibly prevent yourself from getting the viral illness. Well, I hope you learned something from this video. Unfortunately, this viral illness seems to be progressing, and we're probably going to get more mutations in the future. Hopefully, it's going to go on a course where the mutations render the virus less potent, but we'll have to see. Till then, just be careful, do what you can to protect yourself and the family, and be well. Take care, have a good day.